I'm Claudia, and I will be talking about the patient safety and quality care movement. Objectives for this presentation are: define the patient safety and quality care movement, describe different types of safety errors, discuss the Institute of Medicine concepts, explain the significance of the patient safety and quality care movement to the nursing profession and to student nurses. The Patient Safety and Quality Care Movement was a response to the Institute of Medicine's 1999 report, To Err is Human, Building a Safer Health System. This report brought public attention to the healthcare crisis replete of medical errors and ineffective patient safety measures. The goal is to improve the safety of patients and achieve higher quality care through a systems-wide approach that includes multiple stakeholders, including healthcare providers, clinicians, nurses, policymakers, and patients. The IOM defines patient safety as the prevention of harm to patients and emphasizes the need for evidence-based practice in healthcare. Examples of evidence-based practice that have recently been established to reduce negative outcomes in hospitalized patients include the use of heparin and Lovenox to reduce the risk of deep vein thromboembolism, and prophylactic antibiotics to reduce post-op infections, and frequent scheduled repositioning to reduce pressure ulcers. The Institute of Medicine emphasizes the delivery of a system of care that prevents errors, learns from past errors, and is built on a culture of safety that involves healthcare professionals, organizations, and most importantly, patients. The Institute of Medicine outlines 6 domains that are required to achieve improved quality care, including safe, effective, patient-centered, timely, efficient, and equitable care. First, safety. Patients should not be harmed. Care should be effective and science-based. It should also be patient-centered, specific to the individual. It should be respectful of culture and social context. Most importantly, the patient should be involved in his or her own care. Care must also be efficient. It should be time and cost effective, and it must be equitable. All individuals deserve the right to high quality care regardless of age, gender, race, religion, or socioeconomic status. Safety errors. The Swiss cheese model of medical errors states that errors are a result of a flawed system, not just an individual. The origins of the patient safety problem are classified in terms of type of error, such as administering the wrong medication to the wrong patient or removing the wrong limb during a surgical procedure. Communication involves failure between the patient and practitioners, non-medical staff, and other members of the healthcare team. Safety errors in patient management involve improper delegation, wrong referral, or wrong use of resources, and clinical performance involves safety errors before, during, and after an intervention. According to the Agency for Healthcare Research and Quality, the root causes of harm can further be identified as the following: latent failure, which is the removal of error from the practitioner and involves decisions that affect the organizational policies, procedures, and allocation of resources. Active failure involves direct contact with the patient. Organizational system failure involves indirect failures involving management, organizational, culture, protocols and processes, transfer of knowledge, and external factors. And technical failure involves indirect failure of facilities or external resources. Nurses must be critical thinkers when it comes to patient safety and the reduction of medical errors. Of course, nurses are at the front line with respect to reducing falls and reducing errors in medication administration when involved in direct patient care. However, nurses also have the potential to be more deeply involved in the quality care movement. Nurses are the cornerstone of patient care. Their most critical contribution to patient safety is ability to coordinate and integrate the multiple aspects of quality care, as well as monitoring and surveillance that involves early recognition of hazards and patient deterioration before it becomes an error and before it causes adverse events. Nurses are the critical link in communication between patients and their providers. Nurses should also be engaged in clinical education and should encourage the implementation of evidence-based practice in their clinical setting. The Quality and Safety Education for Nurses initiative was developed in 2005 and focuses on preparing future nurses with the knowledge and skills to improve quality care and patient safety. QSIN provides funding for nurses entering graduate programs and has created 6 competencies modeled after the 6 domains of the Institute of Medicine, which include patient-centered care, teamwork and collaboration, evidence-based practice, safety, quality improvement, and informatics. Students must learn to apply competency of patient safety at both the individual and systematic level. To conclude, much research is required to achieve a high-quality healthcare delivery system in the 21st century. However, we have come a very long way. Achieving patient safety means achieving high-quality healthcare. Remember, nurses are fundamental players in increasing patient safety. High-quality care requires multidisciplinary involvement.